Pee. Breathe.
What should you do if you think one of your friends has an alcohol problem? It's hard to confront someone close to you with but this kind of situation should be looked at before it gets out of hand. Alcoholism is a disease that affects the liver. Alcohol affects everything about you and everyone that you are around. How come some people can just drink and have a good time and others are putting their life in danger? There is not one exact answer. Some answers might be genetics, environment, and your social health. If you have a history of alcoholism in your family, you are a higher risk than others. Some drinkers drink to just drink, but others drink because of depression and to release anxiety. It is hard to determine if you're a social drinker or if you're a problem drinker. You might want to think about it and see what side you're on. If you feel guilty about your drinking, or if you think you need to drink in the morning, you may have a problem with drinking. Many times the people around you will see alcohol being a problem before you do. You should seek help from your family doctor with your concerns. Some health concerns that you should be worried about due to drinking are automobile accidents happening because of alcohol. Also, you should not drink during pregnancy, and alcohol can cause stomach ulcers and even worse, liver failure. Some of the signs of alcohol abuse include ongoing neglecting your responsibilities of school, home, and work. Examples of this are doing poorly in school, not paying attention to your kids, and not showing up to work. Another sign of alcohol abuse is drinking and driving and mixing alcohol with prescription medication against your doctor. Not all people who are alcohol abusers turn into alcoholics. One of the first signs of alcoholism is tolerance. Tolerance means you need more alcohol to get you buzzed or drunk than you did before with smaller amounts. The second major warning sign is when you need to drink to take away the withdrawal symptoms, like drinking in the morning to get rid of the shakes. Other signs of alcoholism are having to stop doing other things that you enjoyed because of alcohol getting in the way, and you want to quit drinking so bad but you can't. Diagnosing alcoholism is quite difficult because most heavy drinkers are in denial. There are many tests to diagnose alcoholics with. These tests don't exactly ask questions about how much the person drinks, but questions like problems dealing with drinking. No matter what kind of test is used on the person, the medical examiners use the results to see how many of the 7 major symptoms that person is experiencing. The 7 symptoms of alcohol dependence are neglect of other activities, excessive use, impaired control, persistence of use, large amounts of time spent in alcohol-related activities, withdrawal, and tolerance. Here are a couple of actions from a typical functional alcoholic. Meaning she can hold her liquor, that means she can drink as much or more than anyone else. She drinks like she did in college. She was the first to arrive and the last to leave a party. Even if functional alcoholics see that there is a problem, they still will refuse help. Furthermore, it is extremely difficult to quit drinking once you have a problem. About 95% of people who quit drinking have withdrawal symptoms and can receive medical attention as an outpatient. 5% of alcoholics go through severe withdrawal symptoms and have to be admitted to a hospital. There are 7 steps that go along with withdrawal. These include observation, sedation, tranquilizers, drying out, hallucinations treated, medical conditions treated, and rehab. Most people who quit drinking after a long time have withdrawal symptoms, but not everyone does. A few moderate psychological symptoms include fatigue, shakiness, bad dreams, and irritability or easily excited. Some moderate physical symptoms are vomiting, headache, sweating, especially in the hands and face, and paleness. Furthermore, a few severe symptoms include agitation, blackouts, fever, and states of confusion. With the help of medical professionals, withdrawal symptoms can be immensely decreased or even gone completely.